I'd like to welcome Kristine Weber. And Kristine, I am so thrilled that you're going to be giving a course at IMHU because from what our conversations that we've had, you're clearly a specialist in how yoga and specific kinds of yoga can help with emotional well-being. And most people don't have that knowledge. So I am really excited that you're going to give this course. Would you
Thank you.
please tell us a little bit about yourself and
Mhm,
where you live right now and what
mhm.
organization you have founded with your
Okay.
husband? And
Mhm.
yeah.
Sure. Sure. Well, thank you for having me, first of all. It's really nice to be here, Emma. And so I live in Asheville, North Carolina. I've lived here for about almost 17 years with my husband. My husband, Brett, is a licensed clinical social worker and a licensed clinical addiction specialist, and I'm a yoga therapist. I've been teaching yoga since 1995. My first teaching job was actually working in a nursing home and assisted living community. So I have a lot of experience working with people with limited mobility and also with cognitive challenges. And my husband and I have been collaborating for many, many years, developing what we call subtle yoga. And it's an approach to practice which is really specifically beneficial for mental health. I started training behavioral health professionals, so mental health professionals as well as substance use disorder professionals, and started training them about 10 years ago at the Mountain Area Health Education Center, which is here in Asheville. So we provide CEUs for people that are, typically clinical work, and we show them how to use these practices in their clinical work. So it can range from brief interventions to longer interventions, and we even teach people how to teach a whole group session, so you could fit it into, you could do processing in the beginning and fit it in 30 minutes of practices for self-regulation, and then do more processing at the end. So we've been doing this work for almost 10 years. It's really grown. There's a lot of interest in the work right now. We do differentiate between fitness-based yoga and mental health or resiliency building or self-regulation yoga. We differentiate between those things and help people to better understand. Not that there isn't some crossover, of course there is, but we're really specifically focused on the mental health piece.
And so what can you do in the period of time that we have at IMHU? You and I have talked a little bit about it, and please tell me in your own words what you would like to bring to the audience.
Sure. So what I want to explain, and I think one of the most important things to understand foundationally about these practices is the neurobiologic basis of them. So, we understand the cognitive practices. That's been around for a long time, and that's typically coming from the front brain and doing self-regulation via the front brain, which includes social engagement and rationality and sort of thinking things through and executive functioning and good decision making, all those things, which are wonderful, and we know that they work. But there's another piece to the puzzle, and that is the bottom up piece. And I like to call it the body up piece, because it really has to do with how do you regulate the feelings in your body, the shaky feelings you might get when you're anxious, sweaty and hyper aroused kind of feelings, or the hypo aroused feelings, the lack of energy, the inability to move forward in your life. How do you self-regulate that? And you have to bring the body into the equation, and yoga is a system that's been around for thousands of years that specifically is designed to do just that, to bring the system into more of a state of homeodynamic regulation, homeodynamic balance, so that you can access that front rational brain more, make better decisions, move forward in your life, self-actualize, if you like. So what I love is the combination of both of those, and yoga offers both of those. It does have many cognitive practices, many cognitive-based practices, including meditation, including positive ideation and visualization. All that stuff is part of the tradition, and also ethical decision making.
Ah.
And then the body practices, the practices of using simple postures, simple movements, interoceptive awareness, which helps to develop systems in your body that are really important for that self-regulation feedback loops to the brain, and breathing practices, of course. So yoga tends to have an integrated top-down, bottom-up approach, but there's certainly this bottom-up piece that can be helpful with whatever other kind of cognitive practices that, or cognitive approaches that you are using personally or that a clinician is using.
So in the first presentation you do, then I think we've decided to do like an hour presentation live, and 45 minutes of you really going more into depth into what you've just given us a little taste about, and then 15 minutes of Q&A so people can ask live questions and you'll give answers in that.
Yep.
And then there'll be some videos that will be posted. And do you want to say a little bit more about what those videos are in? Because that's the real practice element,
Sure.
which people would like to see.
Right. And so I want to do a shorter video that's going to show you a bunch of chair things you can do. So that is really appropriate for a clinical setting, or for your, if you're talking about self-care, then for your desk. And then I also want to show you some longer practices you could do on a mat that are accessible. The key thing for us is that we know that people with mental health challenges often have comorbid physical health challenges. So this stuff has to be available to them, and slowly can build up and maybe do, have a little bit more effort or exertion once health starts to improve. But we want to make sure that people can do these. Basically I say, if you can breathe, you can do yoga.
Great. Wonderful.
Yeah, so it doesn't have to be really strenuous foot behind your neck stuff. Like, that's not what we teach. Yeah.
That's a relief, because not many of us can do that.
And myself.
And then I know your husband's not here today to speak for himself, but I understand that he will also join us for a video and speak more about yoga in practice, because he is a licensed psychotherapist.
That's right.
And has been working with you for a long time. So I'm so excited. And this will be in June. It'll be recorded. People can watch it afterwards if they can't make the live recording. The live presentation. And I think we'll just leave it at that. Kristine, thank you so much for saying a little bit more about it. Be well, and I look forward to seeing you again soon.
Okay, great. Thanks.